Okay, so starting with the third part of the lecture. So this will be the last part of the finance and dental care lecture. So starting off with the salary. So in this, the dentists in some group practices, those in armed forces and those employed by public agencies are salaried. Okay, so all the doctors who are like posted under armed forces or those employed by the public agencies are basically paid on salary basis. Okay, so what are the advantages of this? It allows a dentist to be largely free of the business concerns of it allows a dentist to be largely free of the business concerns of running a practice, thereby allowing the dentist to concentrate on clinical matters. Fringe benefits are also often attractive. Disadvantages are basically there could be lack of financial incentive and also some dentists need to be highly productive. Okay, so the next is public programs. For meeting the needs of public who cannot afford private dental care, it is basically sponsored by governments and also includes CHCs. Okay, so public financing of dental care basically includes three things. What are they? The first one is Medicare, second is Medicaid, and the third one is National Health Insurance. Coming to what is Medicare? So, Medicare brought medical care to the aged population of the US without regard to the income. Okay, so it covered it was provided in basically two parts. Okay, so the part A was covering the hospital insurance and the part B was covering the supplemental medical insurance. Dental care was only like limited to services which needed hospitalization. Example of these are cancer treatment, surgical treatment of fractures, etc. Okay, so to provide healthcare to individuals aged above 65 years. This was the like objective of this. So why like these 60 what are the main problems of these 65-year-old people? Basically they have high health needs and they have low income. Okay, so we are done just with the first thing that is Medicare. Now starting off with the second thing that is Medicaid, joint federal state program covering basic healthcare. So basic services that are provided under these are inpatient hospital care, outpatient hospital care, laboratory and X-ray services, skilled nursing facilities, home health services for individuals aged 21 years and older. There's one thing this called as EPSDT, the full form of which is early and periodic screening, diagnosis and treatment for individuals under 21. Okay. So the Medicare was for the people above 65 and EPSDT was basically for the individuals under 21 years. Okay. So it also included family planning services and physician services. Okay, so talking about EPSDT, so it was enacted into law in 1967 and amended in 1989. It basically provided the periodic screening, vision, dental, hearing, and necessary follow-up services. Recipients who were under the age of 21, like who were provided with service under EPSDT. Okay, it was supported by ADA the first time as a federal program mandated dental care for the indigent children. Okay, so coming to the last, that is National Health Insurance. It was introduced by Bismarck in Germany in 1880s and Lloyd George in Britain in 1910. So how to remember this? You can just remember as if like in Germany there's M and in Bismarck also there's M's. Okay, so likewise you can remember. Whereas in Britain there's T which is somewhat written as L. So you can remember it that way. It was like Lloyd George in Britain. It was introduced by Lloyd George in Britain in 1910. Okay. Financing mechanism was publicly organized fund. Factor of development was humanitarianism. Okay. Now talking about the Indian scenario. So basically more than three-fourths of the population resides in rural areas. Okay, so depending on the agriculture for their livelihood. Most of them are poor, no fixed income, due to unpredictable monsoons. So, hence, purchasing insurance for healthcare, paying regular premiums become out of question. In urban areas, some population residing in the slums, called urban poor, who have migrated to cities in search of manual jobs and working poor class people, are basically unable to purchase the healthcare. Population eligible for insurance is only 2%, okay, out of 100%. When it comes to purchase of care, general health receives first priority, as we all know, whereas oral health is okay. So, coming to next, that is financing dental health services in India. So, what are the basically three things that are followed in India? The first one and the most common is the fee for service, second is dental insurance, and third is free or discounted rate. So, these are the things that uh, include finance, dental, also health services in India. First one is hospitals and dispensaries of state government, health centers, rural and urban family welfare centers of the state government, defense and railway services, ESIS 1948, CGHS 1954, facilities of autonomous institutions and societies. Okay, so a public program aimed for the benefit of over 65 years of individual is basically, I've already told, Medicare. Okay, okay. So, and next question here is the national health insurance was introduced in Germany by, I also told you how to remember this. M, there's M in Germany. Okay, so, and there's M in Bismarck. Okay, so coming to conclusion. Private fee-for-service will likely to remain the predominant method of financing the dental care in foreseeable future. Developing countries like India are in transition period during which alternative feasible modes of financing and delivery services will evolve. Thank you.